how I found Dr. Joseph was that my brother and my sister-in-law went there. First of all, it started when I went in for a regular checkup. Dr. Joseph made me feel comfortable when I first got there.
Ms. Hurse is, to begin with, one of my very motivated patients. She was on top of it. She was good with her diet. She was good with her exercise. Initially, when she started to lose a little bit of weight, we sort of said, I wonder if it's just because you're doing really well with your diet, you're doing really well with your exercise. So when she started to lose about 10 pounds or so, that's when, we had to take a step back and say, I need to look for other things.
And so she told me that, hey, we need to go ahead and do a CT scan on your stomach. She said, nothing to worry about. We just want to be cautious with it.
So we did a CT scan of her chest, abdomen, which is her belly, and pelvis, so a little lower. She also has a very strong family history of cancer, especially in one of her siblings.
That's when I found out that I had a spot on my kidneys and my liver. I had no problem, wasn't sick or anything, wasn't feeling bad or anything like that.
So her size was small enough for it to be surgically removed without leaving anything behind. The problem with it, if it had continued to grow and was not caught, is that it can spread, just like any other types of cancers, any other malignancies. And so that's why it was so important to catch it early.
At first I was scared, but Dr. Joseph, she made me feel comfortable and such that, Ms. Hurse, don't worry about it. I will tell you if everything,
So she got her surgery done. Of course, we're doing surveillance in terms of serial imaging just to make sure nothing has grown back again or nothing else was missed. And we have been doing that, and so far, so good.
I'm so happy. I said, because if you hadn't did that for me, I would never known and stuff. You kept insisting me getting it done and stuff, and I wouldn't even had it. Very grateful to Dr. Joseph, what she did and took the time to do it for me and walk me step by step through it.
If there's one point I want to get across, it's please go see your primary care doctor at least once a year. Make sure that you're getting your labs done, make sure you're getting your screenings done, because the treatment and the prognosis, which is the outcome of many of these diseases, is much better if it's caught early.